Very good. Thank you for having me here. And it's a heartfelt thanks. When I first considered opting out, one of the things I discovered was that there were no resources out there. And the AAPS was a gold mine in terms of the resources necessary to opt out. One of the things I'm going to try to do is share some of those hard-fought lessons that I've learned over the last couple of almost 2 years. So one of the things that I'd like to do is talk about this in terms of a metaphor, the metaphor of taking a journey. When you opt out, you're going on a journey, and that journey is going to be at least a 2-year journey, hopefully longer. And you need to prepare for that journey in a manner that's similar to the way that old mariners used to provision before a long journey as they went on to the New World or some other exciting land. So with that, let's talk about how to provision or prepare for the opt-out journey. So as I've already mentioned, there are no maps. You're not going to find books. You're going to find very few lectures, but most of the lectures you do find will be on the AAPS website. What you'll need to do is talk to those who have opted out. And again, fortunately, you have a great resource right here. You won't find help in the more traditional or the typical medical societies such as the AMA, the specialty societies. When I went to them for help, they were absolutely no help at all. In fact, their question to me was, why would you want to opt out? Which makes sense because their whole system of collecting dues is based on helping you deal with this Kafkaesque government system. So it makes no sense for them to help you opt out because you're then opting out of their system also. So the AAPS, members of the AAPS, doctors who have opted out, that's where you're going to have to kind of draw your maps because you won't find them published anywhere. Keep in mind that just as an explorer who would go off from the old world, there's no turning back. So once you're out from port, you're out. Now, it's true that with Medicare opting out, you do have this 3-month provision where you can say mea culpa and come back in. But I would suggest to you that just again, as these old explorers, if you're going to take this journey, you need to be committed. If you're thinking to yourself, well, I'll opt out, 3 months in, if it's not working, I'll opt back in, don't do it. Because what you will have done is basically destroyed your practice without any real benefit. Okay. There's no restocking. You need to be prepared. So whatever kind of financial or other resources need to be collected before the journey must be collected before the opt-out. Recognize that once you've opted out from Medicare, for 2 years, you will not be able to accept Medicare payments. That also means that for 2 years, as a physician, you are essentially unemployable. There's no hospital, there's no medical group, there's no HMO that's going to want to employ you because they all get paid by Medicare or all have contracts that require that their providers are Medicare providers. So make sure that you are well stocked before your journey. And again, it's a 2-year journey. So stock for 3 or more. Just like with redoing your kitchen, you need to actually plan for it to be more expensive and more difficult than you actually think it's going to be. So this sounds pretty bad so far. Why do it? Well, freedom. The freedom to see your patients, to treat the individual in the exam room before you without having that third party in the room, without having to deal with Medicare, HMOs, PPOs, without having to deal with ICD-10, or even now ICD-9, EHR, PQRS, meaningful use, all of these things. These are things that used to cause me great stress. Every time I'd read in a throwaway journal about some new government mandate, I could feel my blood pressure go up. I'd get anxious, angry, frustrated. Well, you know what? I laugh now. I don't have to deal with those things. This freedom is amazing, and it is the primary reason I opted out. And if you're going to opt out, this is a great primary reason to have, because I can tell you right now that even though financially I'm not yet as well off as I was before, the day I opted out, I experienced this freedom, the ability to be in a room with a patient who's come to you for you, not because you're on some plan or panel, not because you take their insurance, but because they want to see you and they value you and what you can provide enough to pay you. That's a relationship that you just can't experience in the insurance system, in the Medicare system. And I'll tell you, it's truly amazing. So greater income. As I said, not experiencing that yet. But I will tell you that of those I've talked to who opted out, after they pass through the first couple of years, they've told me that their revenue, and because their overhead is less, that their take-home actually increases significantly. Recognize that opting out is basically a new business venture. So any entrepreneur, I don't care whether you're a doctor or a dry cleaner, you can't expect to be profitable the first year or so. Okay? I've now reached profitability, what we would call in entrepreneurial circles, ramen profitable. Okay. But it doesn't matter. As soon as your revenue passes expenses by even a penny, you're profitable. Okay? And when you have the ability to charge what the market will bear, what patients value, your income has great potential also. Respect. I'll tell you that I'm now seeing patients who come to me saying, I don't want to see a government doctor. I found out you had opted out, I want to see you. And your colleagues, they'll respect you also. Some of them will be envious or sometimes even jealous, but there will be respect. And improve quality of life. Stress, sure I stress out. For the first year and a half, I was underwater. Okay? That's financial stress. That's not easy to deal with. But it's a whole lot easier to deal with than the stress of constantly changing arbitrary rules of government and insurance and the nasty games that they play with you. Okay? Any business person out there has to deal with revenue and expenses. I can deal with that. Improve quality of life, more time with my patients, more time with my family. So if you're going to do this, you need to do a fitness assessment. What's your current situation? Okay, if you're going to take a journey, you're not going to start the journey out scurvied. You're going to start out well-rested, well-nourished, fit, ready for this journey. So what's your practice like? What's the health of it? Do you have a diet that's rich in cash patients, out-of-network PPOs, or are you eating the junk food of HMOs, Medi-Cal, Medicaid, that kind of thing? Because if you're largely HMO, opting out might be difficult for you. So I would recommend that you work on improving your diet and your fitness of the practice. Financial reserves. Okay, you want to get the lines of credit now. You don't want to wait until you need them. Banks give out money when you don't need it, not when you do. Mental fitness. Are you prepared for this? There will be times when you will ask yourself, what have I done? Okay? If you're not committed mentally to this journey, those are going to be some painful questions to ask. Fitness of the crew. You've got to make sure that your office manager is on board, that your staff are okay with it, your spouse. If your husband or wife is not okay with what this 2 years is going to entail, it's going to be very difficult for you. Beware of pirates and mutineers. Okay? Keep your ears to the ground because there will be doctors in the area who will try to take advantage of your situation. They'll see you as weak and they'll do what they can to steal patients from you. This happened to me in my practice. Also your staff. If your staff are fearful of their jobs, it can be damaging to your practice. So preparing for the opt-out journey, you want to get your business and personal finances in order, get your expenses down. If you can move into a smaller office, if you can let staff go, do so. Okay? Personally, if you don't need that country club membership, sell it off. Okay? Do you really need your cable station with 200 channels? I mean, these are things you need to start thinking about. Start living as if you had less. Make sure that, again, your spouse is on board with this. Selling the voyage, this is very important. Just as the early explorers had to finance their voyages, they went to the kings and the queens. And the kings and the queens all wanted to know the same thing. What's in it for me? What am I going to get from this voyage? Well, you need to be able to figure out what your patients and what the referring doctors are going to get from it. Patients are going to want to know, why should I pay you when I can go to almost anyone else in the community and get this paid for? Doctors are even in a harder sell because they're busy, and even if they believe that you are the one that they'd want their patients to see, how can you expect them to be your sales rep, to convince the patient sitting before them when they've got an office full of other patients waiting that you're the one to see? So if you can't honestly answer this question in your own mind, why people would come and see you and pay, then don't expect anyone else to be able to answer it for you. And I'd say if you can't answer this question, then don't take this journey. Recognize that if you opt out, you're also going to have detractors in the community. Anyone who's left HMOs or PPOs knows this. You will get people out there saying you are just a money-grubbing pirate, that all you care about is money, money, money. Okay. Well, the real reason to opt out of insurance and Medicare is actually for better patient care, for better, personal satisfaction. I've kept my fees at or below Medicare. Okay? Anyone who accuses me of doing this for money clearly is misinformed. Now, in the case of any kind of journey, you're going to run into a storm, and you need to be prepared for saving the ship. How will you cope if you run into a financial crisis? Something was more expensive, you didn't get the revenue that you thought you were. You're going to have to ask yourself, is it worth sacrificing certain things? And if so, what are you willing to throw overboard? What are you willing to sacrifice? Are you willing to remortgage your house? Are you willing to sell your house, move into an apartment? Are you willing to dig into your retirement? I had to dig into mine. That's expensive money. With taxes and penalties, that's 50 cents on the dollar that you're getting. But I'll tell you, I did it because it was a cash flow crunch, and my penciling things out told me that the trends were in the right direction. I just needed another couple of months. I did it. I'm now profitable. I made it through. But you have to be mentally prepared. Decide beforehand what you're willing to do. And then what happens in that case when you've lost the ship? You have to bail. It just didn't work out. Again, you need to ask these questions before taking the journey. What would you do? Would you work for somebody else? As a doctor? Again, who's going to employ you? Consulting work? Well, maybe you have some other unique ability. Okay? If so, then consulting might be an option for you. A career change. A lot of us joke about changing careers. And this might be a reasonable opportunity, but recognize that the grass isn't always greener. What about your bucket list? I know that speaking to a number of my colleagues who are more advanced in their career, they're just getting tired of all this stuff. And they're saying, you know what, when ICD-10 comes out, I'm just retiring. Well, why retire? Why not instead opt out? Give this a try. If it works, beautiful. You've just reinvigorated your career. If it doesn't work, medicine is a hobby, but you're still getting paid. You're just not making a lot. And if it doesn't work, well, then you retire. Okay. So, I've mentioned a lot of things that are quite scary, but my purpose here is actually to prepare you for success. Because if you are prepared for anything, just as with being prepared for tornadoes, okay, your chances of success are higher. So prepare, hoping that you won't need it. And with that preparation, I truly believe that you, as I, will end up appreciating and celebrating true patient care the way it should be between you and the patient. Okay. Thank you.